Hi, I'm Alicia.
And I'm Robin, and you're listening to Bowel Moments,
the podcast sharing real talk about the realities of IBD. Served on the rocks. This week we talked to Kajal Patel. Kajal was diagnosed with ulcerative colitis when she was 12 years old, and she's now in medical school. We talked to her about how her ulcerative colitis sparked her interest in becoming a gastroenterologist. We talked to her about all of her advocacy efforts in ensuring that students with chronic health conditions get everything they need and want from their school experiences. We talked to her about how being diagnosed at a formative age can affect your sense of self and identity. And we talked to her about her volunteering on the DEI task force for the Crohn's and Colitis Foundation and all of the things that she's learned in that volunteer efforts. Cheers.
Hi, everybody. Welcome to Bowel Moments. This is Robin.
Hey guys, this is Alicia, and we are absolutely delighted to be joined by Kajal Patel. Kajal, welcome to the show.
Thank you for having me.
We are very excited to listen to your story, but we're going to start out by asking you the really silly question of what are you drinking?
Well, right here I have some Moscato, but it's Moscato di Asti, so it's kind of a dessert wine, which I really like.
Oh, very nice. You know what? I love a sweet wine with spicy food too. Like, give me a nice spicy Thai and like a Riesling. I'm a fan. Robin, what are you drinking?
I am living on the edge and I'm drinking water. I'm being boring. I'm so sorry.
Well, what people don't know is that Robin was also having to work right before this, like literally right before this. And so since Robin is behaving because she has to work, I am drinking bedtime tea, which might be a mistake because it's supposed to help me sleep, but sticking with tea for tonight. So it's my new one. Well, Kajal, again, we're so excited to have you on the show. Now, next question for you is tell us your IBD story. What brings you into our community?
Sure. Well, thank you again for having me. I really appreciate the opportunity for sharing my story. So I was diagnosed at first with ulcerative colitis when I was 12 years old, and I was the first person in my family to be diagnosed with any form of IBD. So it was very new to all of us. My parents were unsure what this kind of meant for me. I was unsure. So they got me involved a lot with the Crohn's and Colitis Foundation since the beginning, which was great. And they've always been so supportive, which I'm appreciative about. But a little bit of my IBD story. So when I was 12, I was still in middle school, and it was definitely a difficult time dealing with the chronic illness at that time, because it's just like, you're still a kid, you're trying to figure out what you want to do, who you are as a person. It's kind of a rebellious phase too, but I was faced with this chronic illness and I had to mature enough to be able to handle the responsibilities in front of me. So instead of going to soccer games or the school dance, I had doctor's appointments or iron infusions. So that was definitely something that wasn't easy to deal with. And it was when my disease started to take a bigger role in my life. And throughout middle school, I was never completely in remission. I was always on and off medications, always on and off prednisone. Having to deal with the moon phase was definitely not something that any middle schooler or high school wants to go through. But it was always an uphill battle, and it continued even until high school. And during my junior year of high school, I probably had one of the worst flare-ups of my life. My doctor was performing a colonoscopy, and I was just so inflamed that he had to stop the procedure right away because he was afraid if he continued, my colon would end up rupturing. So at that moment, I was immediately rushed to the hospital. I wasn't able to drink or eat anything for a whole week. And then that's when I started on biologic therapy. And then for a year or two, it felt like I kind of got my life back again. It was a new normal for me, at least, because I finally found some relief. I wasn't completely in remission, but I was better than I ever had been before. And this was a time where I was just starting college, having all these new experiences, making new friends. But then when I was about 19 or 20, my disease ended up progressing to fistulizing disease. And fistulas are a complication of Crohn's disease. So at that age, I ended up being re-diagnosed with Crohn's disease. And that was definitely not an easy experience, dealing with fistula and the pain and all the discomfort and problems that are associated with it, especially being 20 years old. And it was at this time that I started being referred to colorectal surgeons. And pretty much every colorectal surgeon I met wanted to operate because that's what kind of was the protocol at that time. It's kind of what they did in these cases where my gut wasn't completely healed and they still wanted to give it a rest. So they were thinking of giving me a temporary ostomy. but I just didn't want one. It was at the time where I'm just like 20. I didn't really want one. So we started getting second opinions. And that's when I met one of my surgeons in New York. And I'll always just remember the visit with him because it had such a significant impact on my life, because it was just through all these years that my disease was just like taking away a lot of parts of my life. And it felt like I was back to the beginning at stage 1 again. I was like mentally preparing myself for surgery and kind of what the future meant. So this visit that I'm going to describe in a moment was definitely a very impactful moment for me. So I remember the doctor coming into the room. He had such just a bubbly personality. He was very charismatic, and you knew everyone around him loved his energy and loved who he was as a person. And I think that's kind of the energy I needed at that moment too. But I'll never forget the first question he asked me. The question he asked me was, how can I help you live the life you want to live? And at first, I was very confused by the question. I was just like, what do you mean? And he was just like, yeah, what's important to you? Like, what do you want to do with your life? And then he kind of redirected the conversation. I was just always used to doctors' conversations being an agenda. Like they come in, they have a list, things that they need to go through, and then on to the next patient. This was the first time that a doctor ever considered how my disease fit into my life. And that's something that I've always appreciated, and I hope I can carry on with me. So that was definitely a pivotal moment in my life because it made me realize all the good I can do, like with all my experiences, all my advocacy work, and kind of channeling those thoughts and experiences and applying it for the better. And that's what led me on to my medical school journey. So I'm currently a third-year medical student, and I'm hoping to pursue a career in gastroenterology just because of everything I've been through, all the patients I met, and just these experiences. I actually had a recent encounter with a pediatric patient. He was 12 years old, and he was just recently diagnosed with Crohn's disease. And it was full circle for me because I was literally looking at myself in the moment. And although I couldn't relate to him as well as I would have liked to in that moment, I could relate to his parents because they had all the questions they were asking me. And it wasn't really the attending or the residents on call that had the answers. It was me. It was me printing out the information that they needed, what they needed to do to make sure he was all set and good to go. And it was just so reflective. And I was just so thankful for that experience because I realized like if I only had that experience growing up. So it was definitely very meaningful to come full circle and back to that.
I am tearing up when you just shared what that surgeon said to you. Like as a patient, it really, I mean, what a breath of fresh air. Like what a relief to have a doctor ask you that question. And then you're talking about helping the parents of this 12-year-old. I mean, every time I talk to a patient, I feel like this is why I have Crohn's. Every time. I have to get off. I have to go back on mute because I'm going to start falling.
No, I think that's such an important point. You know, it is those moments where you realize perhaps, you know, how you can affect people's lives, how you can impact their lives in such a positive way, even though this was such an impactful thing for you and perhaps some very negative ways. And so I think that's a great way to take this crap that you've been given and turn it into something that's meaningful and impactful. So I think that's beautiful. When we were talking before Robin was able to join us because she was finishing up her work call, you mentioned that you were going through different types of rotations and that you just finished a colorectal rotation, and that did change your mind a little bit about colorectal surgery. However, I am curious a couple of things. One, because in that moment you were the expert with all of the other people in the room, with these parents, with the kid with Crohn's disease, has there been other times where your Crohn's disease has been able to help some of your fellow students better understand some of the things that are happening with patients? That's number one question. And then I do want you to talk a little bit more about like why the colorectal rotation was so interesting to you.
Sure. So reflecting on your first question, actually with one of my best friends, we co-founded an organization on our college campus called the Alliance of Disabilities of Chronic Illnesses in Medicine. And this organization we're using to raise awareness about people with disabilities, whether that's Crohn's disease or individuals with physical disabilities. It's just on a broader perspective, raising awareness, while also making the student body understand that as future medical professionals, we can have our own ailments. And it's kind of creating an open dialogue to have these conversations. So that's something that I've been actively doing on campus with some of my friends to highlight the significance of having chronic illness and how it impacts us. And like, it's not only the patient that goes through things, but it's everyone, because at the end of the day, we're all human. You'll have our problems. So it's just better to be open and understand what everything is going through, because it's the stories we share that can be embedded and passed along to each other and just shared for the benefit of others.
I love that so much. And I think it also, that reminded me of a conversation I got into here recently with a nurse who I believe she actually has IBD. And, but she was talking about how she couldn't go get her infusions because she's a nurse and you don't get to just leave for a few hours in your day if you're on shift, and about how that actually she started her own infusion center that has after hours because she's like, I understand that people like me can't get it. And so even just the like raising awareness amongst your other medical professional folks around like the needs of people that are living with chronic illnesses that are also medical professionals, I think is super interesting. So that's great. Are there activities that you guys do in particular that helps with this? What is the sort of the programming that goes along with your alliance?
A lot of things we do, we invite guest speakers over, so people with disabilities to talk about their journeys, what they're going through, because we don't always realize it. Like, although I have Crohn's disease, I don't know what a person with MS is going through. So it's just highlighting the problems that patients face and bringing them into a broader light so more people can appreciate how to manage the care of those patients. For example, we also had a patient in a wheelchair, and it's just a physical exam is very different for a patient in a wheelchair compared to any other person. And it's just, what can you do to enable that patient to have the best care possible? So it's highlighting these experiences. So when we go into the real world, we know how to deal with certain cases without being biased and just kind of having the best tools in our pocket. We also created some pocket cards. So it kind of outlines like the do's and don'ts of certain questions to ask someone with a chronic illness, just because we're not always aware of how people may react to things. So just having an open mind and kind of creating just that avenue. Just, I think a lot of education that we're doing so people can just have the tools to equip them for later on.
You're creating more empathetic and sympathetic medical professionals, which is what we all need. I love it so much. I mean, congratulations. Seriously, that is a great, great thing. I would love to see that expand to other campuses.
Well, and just, raising awareness of a different type of inclusivity. I think right now a lot of inclusivity means making sure that we're welcoming people that have felt very marginalized in our societies for a really long time. But this is really highlighting a different aspect, I think, of inclusivity that's really, really important, because there could be people who don't feel like they can be a doctor because they're using a wheelchair or because they have some type of medical condition. And, just having a group like yours really says, no, that's not a thing. We can still be everything we want to be, even if we're living with IBD or MS or what these other things are. So I love that. I love that so much. Now, my question for you about rotation with the colorectal surgeons, because I'm curious how that changed now that you've spent some more time with this. It sounds like your colorectal surgeon was amazing, but
Yeah, so just reflecting on my colorectal surgery rotation. So in medical school, we have different rotations where we go in different subspecialties and we kind of get to experience each of them to gain the skills in each of the professions. So I recently had a colorectal surgery rotation, and surgery is known to be one of the harder professions just because the hours are long, there's a lot involved. So I was going into it thinking that I'm not going to have the stamina for this. I'm not sure if I'm interested in it. But once I met the colorectal surgeons, I was very taken aback because they were just so genuine and kind and very understanding. I was in a safe space and I felt comfortable sharing my Crohn's disease with them. And they were more than open arms, willing to listen to my story and what I've been through. And a point that actually the colorectal surgeon brought up is he was also just saying that a lot of gastroenterologists don't realize all of the ailments that go with colorectal procedures. And I was learning a lot that I didn't learn in my GI rotation. So it was kind of interesting, combining the two together and realizing they're more related together than one would think. And he was also just reflecting on how a lot of gastroenterologists don't have a lot of knowledge about rectal cancers or rectal disorders. And I feel that as I'm going through my rotations, I do realize that there's kind of a gap in that. And maybe in my future career, that's kind of a gap I kind of want to figure out on how to close that loop better. Because speaking from own personal experience, my fistulizing disease ended up being caught later than it should have been. And it was because at the time, my GI doctor didn't really have much knowledge about fistulizing disease or the complications of potentially having Crohn's disease. And then he delayed my visit to see a colorectal surgeon. And it was just in that time in between, if he had the knowledge or had the expertise of referring me, it would have prevented a lot more complications. So I think I'm getting a more appreciation of the colorectal field as well. And I'm just respecting it a lot more in what they do as physicians.
I think think that's really important point. And I really want to ask you a completely off-topic question, and then I'll come back to it. So here's your curveball question. In going through your rotations, was there any rotations that you were like, absolutely never?
Honestly, OB-GYN.
That's totally fair.
Yes, it was just a lot. The hours were a lot. I'm like, I don't have the stamina for this, or like it was a lot. That's all I can say.
Totally fine. Listen,
That
we
is
all
fair.
make choices. I hear you when it comes to the cancer aspect of talking to folks with inflammatory bowel disease and keeping that in the back of your mind as you're working with people with IBD. But the C word is definitely something that's real hard for people. Like as soon as anybody hears cancer, their brain just kind of shuts off. So how do you think as a future medical provider that you're going to be able to have conversations with patients about their increased risk of cancer when they do have inflammatory bowel disease in a way that's not going to completely shut them down?
I think this also goes back to the patient themselves. And as I'm realizing in clinic, like some patients want the straight answer right away, and some people want a more like prognosis. What are the next steps? So I think a big part of it deals with understanding your patient and understanding what they would want. So I think that's first and foremost, realizing the doctor-patient relationship and what they will and will not want to hear. But at the end of the day, even though it is a scary topic, it's still relevant and pertinent information that we need to disclose in some way, because it's just, they have this illness now, and what are the next steps we can take to prevent this from progressing? We actually had in colorectal surgery today, we had a patient with pre-malignant adenomas, so kind of like growths in her colon. And because we caught them early, although she was scared, we were able to remove them and we prevented her from having colon cancer. So I feel like also being anecdotal with stories and making people feel like they're not alone is also very important. And I feel like reassuring the patient that, that they have a team working with them, that we're going to look out for their best interests, which I hope all doctors do. But at the end of the day, I think it is an important topic of conversation. And it's something we do need to reflect on, because we don't want any disease progression. Even though it's scary, there needs to be a way that we address that.
One of the things that Kajal mentioned is, and that you, Robin, can 100% relate to, is all of the things that go along with living with a chronic illness, like the schedule, the MRIs and the changing meds and the iron infusions, like how to cope with all of that, especially as a kid. I mean, like when you're starting to do all that stuff at 12, that's challenging.
How do you schedule that around school? Like you're talking about people, the foundation that you formed with your friend, it's people with disabilities in medical school. Like you still have to have all those treatments, and medical school is very demanding. So, I mean, I go through phases of, I just don't have the energy to schedule all these appointments right now. Like I'm about to have to start scheduling iron infusions again. So I went through like 6 months with no iron infusions, and it's about to start ramping back up again. So how do you find time to work that in with what you're doing and really just excelling in your school life and still maintaining all the things that you have to do with chronic illness?
So it's definitely a balance. And I think that the fact I've had my illness since I was 12 kind of prepared me of how to handle this. So when I was younger, it would be easier to take time off school for appointments because I was always with my parents. It was easier to get the excused absences. Actually, I remember a few years ago, I counted how many days I missed of high school, and I missed probably about like 60 days of high school. But with that being said, in high school, I had a 504 plan. So the 504 plan allowed me to take these absences and not kind of get penalized for it. So that was one thing through like middle school and high school. In college was a lot more flexible because you don't have classes every day. You're able to work around your schedule and kind of fit things in. So college wasn't as difficult to set things up. As for medical school, I also registered with our disabilities office, and I'm also allowed extra absences than my peers for these reasons. For like, if I have Crohn's flares, I need to take an exam at a certain time, like I'm allowed to do that. I feel like most higher education programs will work for you. You just have to ask for what you need. Like they're not going to tell you what you need. You have to make sure you're an advocate for yourself and say, you need this time off for this reason. And just make sure you stand up for yourself. As for my appointments and treatments, as of now, luckily my medication gets shipped to me. So that works out very nicely and very smoothly with my schedule. So I just take my injection in the evening and I don't have any issues. As for doctor's appointments, I try and do them virtual as many times as possible. possible. So I'm living in Florida, but I still have my care in New York. So I try to keep up with my virtual appointments. And then when I'm back home for breaks, I do all my procedures. And then what I kind of have nice, there's been a few instances where I've had relapses of like my fistula and I need surgery and treatment right away. And my doctor knows this too, that I'm in Florida. So he knows like I'm flying up to see him. So he'll make time in my schedule to see me. And the school is also very understandable about it, knowing like I need to take the next flight out of here and get treatment. So it's kind of working around the system and with the people that are with you and seeing what you can and can't do for the most part.
I do want to highlight that the 504 plan for school age patients. And then we've talked about this before with a couple of our other guests about registering with disabilities on campus to make sure that we've heard a lot of people say, oh, well, I didn't want to do that, but it's key. Like it really comes in clutch if you have a flare or you need to get tested, you have to go to the bathroom while you're taking a test where your professor won't let you go. So if you're a parent with a pediatric patient, definitely, if you haven't been told this, that you want to set up a 504 plan for your child. And again,
Even
I know
if
you're
they're in remission.
Yes,
Key.
yes, even if they're in remission. And I know everyone in college, you are adults. You don't need me to tell you this, but I'm going to. Please register with the disabilities office on campus. It will make your life so much easier.
Even if you're in remission.
Yeah, thank you, Alicia. Thank you.
I couldn't agree with that more because in high school, I had instances where I would be in the hospital for a week and the teachers didn't believe I was sick. And it wasn't until I got the 504 plan that they're like, oh, she actually has something. So it kind of gives you the power to say that you have something and you shouldn't be denied equal treatment because of it. So I completely agree with both of you.
Especially when most of these accommodations are pretty simple too, like, okay, stop the test so you can get up and go to the bathroom if it's a time test, just, I don't know, it feels small many times.
Exactly.
When you and I talked previously, we talked about your advocacy work. And so I wanted to ask you about how did you get involved in that? What do you like about it? And what kind of advocacy activities have you done specifically?
Sure. So as I was touching upon in the beginning, my parents got me very involved with the Crohn's and Colitis Foundation, from attending Take Steps walks to conferences. So at a young age, I was exposed to it. And in college, I was selected to be part of the National Council of College Leaders for the Crohn's and Colitis Foundation. And that was such a great experience because I was able to connect with like-minded individuals of the same age. And we worked on raising awareness. We went down to Washington, D.C. and advocated for step therapy protocols. And it was just very reflective on the good you can bring and the change you can do with just like having the conversations and leading those sessions. So that I did a lot of in college. I was also the honored hero of the Take Steps walks in 2018. And I was sharing my story again. And I remember parents and like little children coming up to me and saying like how grateful and how thankful they were for hearing my story. And all of that always means so much because it's why we're doing this, right? It's why we're having this podcast, just to make sure people don't feel alone anymore. And I think that's the most important part. And then I still work with the Crohn's and Colitis Foundation. I'm currently part of one of their diversity inclusion programs. So we're focusing on highlighting IBD right now in African American and Hispanic patients. At my medical school, I started ADACIM, which is a disabilities organization. And I also had the opportunity to be involved in something called MedX at my medical school. So MedX is very similar to a TED Talk. So I pretty much gave a TED Talk about my chronic illness journey. And it was just very empowering and very impactful because not everyone in my class knew what I was going through. So it was kind of having that space to be open about it. And I just received so much compassion. It was very nice to finally be open about everything.
That's so cool. I love that. And just what a great way to raise awareness amongst all of the other students. One of the things that you wrote on your questionnaire we send out to folks is that you said that you used to think that you were your disease, that you very much identified with your disease and it was a big part of you, but that obviously you've reached a place where that's not the case. Talk to us a little bit more about what that was like and then kind of how you've evolved away from that.
Sure. I think being diagnosed at 12, it's just you're a preteen and you're like in a rebellious phase trying to figure out what you kind of want in life. And for me, my IBD was the center of that. It took up my free time. It took up what I did over weekends. After treatments, I would just be exhausted. And it felt like my IBD was kind of like this monster that was eating me slowly away because I never found relief. It was actually only until last year that I was completely in remission. So it's always been an ongoing battle. So for a good part of my teenage years and early years, it was a big part of my life. And I think I slowly started to get over that, one, with doing a lot more advocacy, and two, my experience with my doctor, like him highlighting the significance of you are more than your illness, you're all these other things that are so important. And I think kind of reflecting on that a bit more definitely changed of how I viewed myself. There was a time where I would focus a lot on the what ifs. What if I didn't get better? What if this medication doesn't work? And it's kind of instinctual to think that way because we're programmed to think of all the negative consequences that can happen. It also took some reflections to realize that what ifs can work in the other way. Like, what if this medication does actually work? And what if the reason I'm going through this is because I found my purpose? And it is true. I did find my purpose through my illness. And that's why I've come to love medicine. It's funny to think that if I didn't end up being diagnosed with IBD, I'm not 100% sure I would have gone down the medical route. So it's kind of led me on this journey. And I feel like it's kind of taking all of that and thinking that what ifs work the other way too, and they can be seen in a positive light.
I like that. It's kind of saying, what if this kind of crappy experience is helping me find purpose? And so I think that's a cool way to reframe it.
Exactly.
One of the things you mentioned is, being diagnosed at 12, you felt like perhaps that kind of contributed towards some of this. I am curious about that because I do wonder if we see people that are perhaps when they're diagnosed younger, feeling like this is more of a part of them and the part of their identity versus people who are diagnosed later in life, or is it more just the circumstances surrounding it? Feel free to philosophize on that for me.
I feel like I understand what you're saying, but it's like to each their own almost, right? So for me, like these experiences were kind of like in my development, but I know for other people, because of their illness, they change their career path. So it's hard to say. I'm not sure if I'm answering your question, but I understand both sides.
I'm not sure I asked a question either, so don't worry.
I understand how both sides, like some people end up changing their career paths after their diagnosis, realizing they want to do something else. Whereas for me, it kind of shaped my trajectory of where I was going. And I feel like everyone has their own interpretations and kind of how they use their illness in some sort of way.
Yeah, I know it's more of a like just wondering out loud because I can imagine, 12 is such a formative age that I do wonder if that sort of creates this sort of system where, kids maybe start to take that on as a bit more of their personality because that's just the stage you're in, when you're 12 is you're figuring out who you are and you're forming yourself. So I don't know.
It's interesting because we know people that were diagnosed younger, and I feel like they've collectively, not every single person, have been more like, well, I don't remember not having IBD. So not that it's who they are, but that's just life because they don't remember anything other than life with IBD. And I feel like 12, you do remember, your childhood before IBD. And I often think and have said that I kind of feel like it's a little bit harder for people who are diagnosed slightly older, like in college or maybe right out of college, because you have this idea about what you're going to do. And then life throws you this curveballs. But 12 seems like it might be that way also because you're thinking about where you're going to go to college or what do you want to be when you grow up or, so I'm philosophizing that for you out loud. Sure.
Please do. The more people philosophizing on this, the better, I feel like. Because I'm curious whether just because of the time of when it happens is that exact time when you're like, this is me becoming my future me. So
Alicia asked you the question about when you're doing your your rotations, like what was a hard no. Is there anything else that you did that you're like, oh, this is a maybe that's, that surprised you that maybe that's outside? Because you said that you wanted to be a gastroenterologist because of all of your experiences, but is there anything else? Because we talked to a doctor recently who full on doctor career and then changed like primary care and then decided to go back and specialize. So was there anything that you have experienced that you're like, oh, I kind of like this too?
Yeah, for me, I know the answer to that right away. For me, it was psychiatry. It's just a very intriguing and interesting field. And I feel like I like talking to people. I like understanding where they come from and kind of helping them work through things. So I enjoyed it a lot more than I thought I would. And I saw myself for a bit of time, like potentially working in that, like potentially working with patients with chronic illnesses specifically in that space, because I haven't really come across, there's some in some groups, but there isn't one that's specific psychiatry is just designed for chronic illnesses. So that was piquing my interest for some time. But then I got into my internal medicine rotation and I'm just like, I think GI has my heart. But it was pulling at me for a bit.
No, I love that. GI psych. That would be amazing.
Yeah.
Get all of your classmates who liked psych and tell them chronic illness.
For real. Go back to a little bit. You mentioned being part of the Crohn's and Colitis Foundation's Diversity and Inclusion Initiative. Talk a little bit more about kind of what are they looking at? What have you learned as part of that? And where do you see the future of this initiative kind of going?
So the Diversity and Inclusion Program, there's probably about 5 to 7 of us, and we're working as a group to try and figure out how we can reach certain target populations, such as the African American populations or the Hispanic populations, because we feel our outreach hasn't been as much as we would like in the past years, and we're missing out key demographics. So we don't want to miss reaching out to them with opportunities, resources, and care. So far what we're doing is we're having small session groups with African American populations and Hispanic populations. We're in the works of setting those groups up around different states. I believe we have one being set up in Georgia. And then as for expansion, we plan out to reach to other ethnic groups such as the South Asian IBT community. So we feel like we can target specific groups who haven't really been represented a lot in IBT care. We want to make sure we end up hitting all the demographics just to have a full comprehensive care for patients.
Like, were there certain things that came up, like kind of bubbled to the surface as you guys were starting to form these groups, starting some of these discussions that you think are like higher priority issues that this group wants to tackle?
Yeah, so we were kind of brainstorming areas to target where we would have specific conversations where we would hit our target demographics. So for example, Miami has a large Hispanic population, and we were thinking of holding a conference here and picking certain areas where those demographics aren't really reached. So having discussions about where our next potential targets can be and how as we as members can help assist in that.
In assisting in like creating education programs or like roundtables or?
Exactly. Mostly education panels and also just small group sessions. So similar patients can relate to each other and have an opportunity to meet each other.
Yeah, I think that's super important.
So using Miami, for example, would it be like Spanish language?
Yes.
Programming or okay.
Yes.
Okay. That makes more sense. I just wanted to clarify because it was like reaching the population, but also speaking their language. So
exactly.
Okay. Yeah.
So your family was involved with the Crohn's and Colitis Foundation. This was something that was brand new to them. What's been their take on your disease? Have they gained a different perspective on it, especially with you now in medical school? When you were diagnosed, were they able to sort of point back to any family members to be like, oh yeah, that's probably what that was? I'm curious about that.
So my family has definitely been very supportive of me from the beginning. There was a point in time, though, I think I was in middle school, where in combination with my normal medicine, we also started using homeopathic medicine. And then we realized a few months in that it wasn't really working anymore. And why are we doing this? So I ended up stopping it. But there was also a bigger conversation about the side effects of certain medications. And it was us as a family deciding kind of the next medicine I should take, the next steps. So it was a very cohesive environment where we're trying to figure it out. But I think a lot of the times for the medication I had, we would end up being like Dr. Google. Like we would look up like, what are the side effects of this medication? What do I need to look out for? And then now on the other side of things, as I'm in the medical field, I realize like most of these side effects occur in less than 1% of the population. So just a small tidbit, whatever you read on the internet is not always completely accurate. So always make sure to ask your doctor about specific numbers of things because you don't know what you'll end up reading. And we kind of fell into that pattern. We ended up reading too much and getting ourselves worried about what these medications would like do and not thinking of like, well, the benefit it could give me. And it wasn't until that I started on these medications that I realized like I can actually have my life back. So it's also another piece of advice, like don't let the side effects of medication scare you because you can have the life you always dreamed of having, or you can have a life back that you once thought you never thought would have back.
I often say to patients, put your hands up and step away from Google. Just hands up, back away slowly, because you do see all the horror stories, right? I'm sad to say that it is time for me to ask you the last question. So what is the one thing that you want our community listening to our conversation to take away? What's the one piece of advice that you have for them?
Sure. My advice would be to not let your illness consume your identity. You're a lot more other things than just your illness. For me, for example, I'm a daughter and a sister. I'm an optimist, an advocate. I'm a patient, but I'm also a future physician.
And you're a painter too. Throw that in.
Yes, and a painter too.
Perfect. Thank you so much. It was really, really fun to talk to you and to hear more of your story and to get to know you more. So thank you so much for joining us for Ball Moments. And thank you everybody else for joining us. And cheers.
Cheers. Hi, this is Kajal. If you enjoyed this episode, please rate, review, and subscribe and share it with your friends.